Hey everyone, it's Dr. Arlene Diamco, the multidimensional MD. I am so happy to be here with all of you today. And as always, my mission is to bring the intuitive aspects of health back to medicine in practical and tangible ways so that you can access deeper healing and experience more peace, love, and joy in your everyday lives. So sometimes I talk about the bigness, the grandness of spirit, and sometimes I go a bit more micro. And so today's conversation is going to be a bit more in the physical because I'm going to talk about cannabis use and psychosis. And the reason I would like to talk about this is because it's been on my mind for several years now. And it's something that is known in the medical literature, but is not widely known in the public. So I wanted to go through many questions about this. One is, well, first of all, what is cannabis? What is psychosis versus schizophrenia? What is cannabis used for medically? And how has cannabis changed over the years? What is the risk of cannabis use in psychosis? And what is the pathophysiology behind cannabis use in psychosis? How could glycine possibly help? And how do you talk to teens about cannabis use? So the first is, what is cannabis? Cannabis, which is also known as marijuana, weed, or pot, is a psychoactive drug from the cannabis plant. There are many different variations. According to a 2021 survey, about 20% of people 12 years or older use cannabis, and about a third of those people have cannabis use disorder. So this is a huge issue now, and there are many things that cannabis can be used for that can be helpful, but we need to determine what it can be helpful for and what it can be detrimental for. And anything that has the potential to help also has the potential to harm. And so we need to be able to approach things wisely, not and responsibly. So, what is psychosis versus schizophrenia? Psychosis is a break from reality, a condition when you may have difficulty determining what is real or not. And schizophrenia is when you've had those symptoms for at least 6 months. That's the brief definition. So schizophrenia can be broken down into three types of symptoms. There's the positive symptoms, the negative symptoms, and then the cognitive symptoms. So positive symptoms are symptoms that are displayed outwardly, like hallucinations, delusions, disorganized behavior, disorganized speech or thinking. Negative symptoms are like they seem like the absence of things. So anhedonia, which is the inability to feel pleasure, which is a horrible way to live, and it could be so a lack of motivation or a flat affect or that blunted expression, whether that's expression in speech, expression with your body, your voice, and other speech symptoms like having a monotone voice or 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 poverty of speech, like not speaking much at all. And then we have the cognitive symptoms, which are attention issues, memory problems, difficulty with finding words or word retrieval, and other executive functioning skills such as problem solving or planning. Now, what is cannabis used for medically? Nowadays, cannabis is legal for medical use in most states, and recreational use is actually legal in 24 states. So that's really interesting. The landscape of cannabis has changed dramatically over the years. So I did look up for the state of Georgia qualifying conditions for a low THC oil card include the following: AIDS when such syndrome is severe or end stage, Alzheimer's disease when also severe or end stage, amyotrophic lateral sclerosis or ALS, again when severe or end stage, autism spectrum disorder when A, patient is 18 years of age or more, or B, the patient is less than 18 years of age and diagnosed with severe autism. Cancer, when diagnosed as end stage with treatment, produces related wasting illness, cachectic or recalcitrant nausea and vomiting. Crohn's disease, epidermolysis bullosa, it's a skin disorder, intractable pain, mitochondrial disease, multiple sclerosis when such diagnosis is severe end stage, Parkinson's disease, also severe end stage. If a patient's in a hospice program, peripheral neuropathy, PTSD, seizure disorders related to epilepsy or trauma-related head injuries, sickle cell, again, severe end stage, and Tourette's syndrome when it's severe. So there are many, many things. This doesn't mean that those are the only things that cannabis can be used for medically, but in the state of Georgia, those are the things that a low THC oil is allowed to be prescribed. And then you sign and have a medical signature and also apply for a THC card, and your physician helps you do that. In other states, it will vary. Now, this is so interesting. How has cannabis changed over the years? And I want to show you this graphic. So if you're watching on YouTube, then try to blow it up, because this is from, I have to look at this closely, 1995. So the THC concentration in cannabis samples seized by the Drug Enforcement Administration, in 1995, the THC levels were about 4%. Versus in 2022, the THC levels were over 16%. That is huge. So if you are a parent and you used cannabis, weed, marijuana growing up, then that is going to be far different than what is being used nowadays in general. And so that needs to be taken into consideration, because a lot of times people say, oh, it's just pot. It doesn't have any, it's not going to be harmful. It's not going to have like any long-term effects. But when you see that difference in concentration of the THC, it is very different nowadays than it was. So that takes us to, what is the risk of cannabis use and psychosis? Cannabis use is known to be a risk factor for psychosis. I'm going to pull up another graph here, and this shows you, one second, let me see, find that. Okay, there. This is on cannabis use and psychotic disorders among teens. And so this is in teens who didn't use cannabis. By the time they were age 20, their risk of psychosis was about 0.5%. So that's less than 1%. In teens that used cannabis, and this was a study in Canada, so who knows, maybe it's different in the US, but I would say if they found this in Canada, it's going to be somewhat similar, maybe even worse. So teens who used cannabis, by the age 20, that risk went up to 4%. That is an 8 times increased risk. So, and we talk about 4%, that's 4 in every 100, people that are using cannabis have experience psychosis. That is not insignificant. That is huge. Okay, so given this is not meant to scare everyone, this is to give you information that is useful so that you can make wise decisions, because we don't want to just toss it off like, oh, it's just weed, it's just marijuana, it's just pot, no big deal. Everybody is different, and we're going to go through that pathophysiology. But let me explain more about the cannabis use and psychosis. I'm going to leave this graph up for a little bit so you can see it. So not everyone that uses cannabis develops psychosis, and not everyone that has psychosis has used cannabis. Okay. And what me saying all of this doesn't mean if you used cannabis, it doesn't make you a bad person. I just want you to be aware of the effects that it could have, and it might not have that effect on everyone the same. Those that have been diagnosed with cannabis-induced psychosis have a greater chance of developing schizophrenia long-term. This is known in the literature. This is nothing new, but this is not widespread knowledge, which is why I'm sharing it with you today. Because I've seen this happen too many times. 15% of new cases of psychosis are attributable to cannabis use. I've seen this again too many times. Frequency matters, amount matters, potency matters, age of use matters. So the more frequently that you use it, the more in one time that you use. The dose matters. The potency. So again, that THC concentration that I showed you in the graph before, that's risen dramatically over the years. It's much more potent, and that matters. And the earlier that you use it matters. There's this vulnerable period where your brain is developing. It's a really long period. It's like all through childhood, but it also is through your early adulthood too. And so some people say, oh, if you could, if use it at all, just if you could postpone it, unless you need it for medical use, postponing it until like age 25 or later, just let your brain develop a bit more and get out of that more vulnerable period. Other drugs also increase the risk for developing schizophrenia spectrum disorders, but cannabis of the drugs has the greatest known risk. Cannabis use after the onset of psychosis is associated with a worsening of psychotic symptoms and outcomes, meaning they had more psychoses, they had more relapses, they had more ER visits, hospitalizations, legal problems. It has not been shown to be helpful for some people are saying, oh, but they're self-medicating. It has not been shown to be helpful in decreasing the risk of psychosis. And instead, it's the opposite of that. And then with chronic cannabis use, there's also the risk of cannabis withdrawal inducing psychosis. So you got that. If you use it, it can induce psychosis. If you stop using it, it can continue. If you have been using cannabis for a long time, then the withdrawal of it itself can induce psychosis. And they've seen that. And people like say they were hospitalized for something else and they had been chronic cannabis users and then develop psychosis during their hospitalization or whatever reason it was that the use was stopped. So many interesting details here. Now, what is the pathophysiology behind cannabis use and psychosis? Now, just so you know, the exact cause of schizophrenia is actually not known. And if we think about it more from that mind, body, spirit perspective, the mind is awry. That spirit connection with the mind and the body has gone awry. There's something loosened, and I think of it as, if I think about it from a spiritual perspective, I think about it as you're not fully embodying your spirit, that spiritual side of you, and your mind is not fully connected with it, and so you have that break in reality. The most common hypothesis of schizophrenia is based on the dopamine hypothesis, in which elevated dopamine levels contribute to schizophrenia. So many pharmaceuticals were created based on this hypothesis, including the dopamine blocking drugs Abilify or Risperdal or risperidone, Seroquel, clozapine. However, the negative and cognitive symptoms of schizophrenia that we described before do not often respond to these medications. And that's key because that means there's more to the story than the dopamine hypothesis. Dopamine is playing a role. They're seeing some effect with the medication, but it's not addressing all of it. So there's more to the story. So we can take a look at another neurotransmitter, glutamate, which is the most abundant neurotransmitter in the brain. And it is also the main excitatory neurotransmitter. So it's involved in 90% of excitatory signals in the brain. While just to compare, GABA is the main inhibitory neurotransmitter. Glutamate binds to 4 different receptors, and one of those is the NMDA receptor. Excess levels of glutamate can be neurotoxic. And so high glutamate levels, they can be associated with increased pain sensitivity, multiple sclerosis, Alzheimer's, Parkinson's, Huntington's, stroke, fibromyalgia, chronic fatigue. Notice some of those things are things that we said that, that cannabis could be helpful for, which is interesting because if those are high, cannabis actually is an antagonist to these NMDA receptors. And so you're starting to see like understand the pathophysiology there, the potential pathophysiology. If there's excess glutamate and cannabis can bring those levels down, then it can be helpful for some of these disorders. Other disorders and issues have been found to be associated to problems with making or using glutamate, and this includes mood and anxiety disorders, autism, depression, OCD, schizophrenia. And those low glutamate levels are associated with trouble concentrating, mental exhaustion, insomnia, low energy. So this can start to explain the variations in people's responses to cannabis. So if somebody had higher glutamate levels or normal glutamate levels, then they might have a positive, like a good response or a feel good response to cannabis. But for a person who maybe already has lower glutamate function levels or hypo function, hypo means low functioning of that NMDA receptor, then they might be those people that they have a bad trip the first time they use it, or they don't feel good after using cannabis. And so we need to understand that there's this individual variation, and that can explain some of this individual or these various responses to cannabis use. So in a person that already has hypofunction of the NMDA receptors, low glutamate levels, then drugs or medications that are known to be antagonists of these receptors, that means they block these receptors. And so if you have low level function and then you put a blocker, if you bring it down even more, they could exacerbate or worsen the problem. So if you are a person at risk for psychosis and at risk for psychosis with cannabis use, or at risk for schizophrenia, anything, or if you're a person with low function of NMDA receptors, then the following things might be detrimental to your health, including cannabis. Ketamine is also an NMDA receptor antagonist. And although some people do really great with ketamine and it's being used in mental health and can have amazing results with it, not everybody has the same experience. And I have heard stories of people doing really badly with ketamine, and it's for the same reason. It's an NMDA receptor antagonist, or in terms of like my thinking and reviewing all the literature, that's why not everybody is responding the same way. And there's some people that do really well and other people that don't do well. Other drugs that block the NMDA receptor include Robitussin or dextromethorphan, nitrous oxide, phenylcyclidine, methoxetamine, methadone, and some Alzheimer's medications, haloperidol, and then some other medications as well. I have the whole a list. If people are interested, then you can contact me. Other drugs that are also known to increase the risk of psychosis, which may affect these receptors or may work through another mode, include cocaine, PCP, amphetamine, methamphetamine, mephedrone, MMDA or ecstasy, LSD or acid, and psilocybins or magic mushrooms. If you have had any bad experiences with cannabis, then I encourage you not to use it. And if you are using cannabis regularly, and especially under the age of 25, then I really encourage you to lower the use or consider not using it. Okay, let's talk about something hopeful. How might glycine help prevent or treat psychosis? So remember, glutamate works on one of the receptors glutamate works on is NMDA receptor. Cannabis blocks that receptor. Glycine activates that receptor. It's an NMDA receptor agonist. Agonist means it helps in its function, activates it. Glutamate needs glycine or D-serine, those are both amino acids, glycine and serine, to bind to NMDA receptors. If a person has reduced function at the NMDA receptor, then glycine can provide a boost. But glycine does not cross the blood-brain barrier well. So if you're taking supplements, then large doses are needed for it to work well. There have been a handful of small studies, mostly done on inpatients with taking that were on antipsychotics. When glycine was added at high doses, we're talking really high doses, like 70 grams or above, patients had even better results than just on the antipsychotics alone. They had large improvements. These are inpatients, so they had severe schizophrenia. They had huge improvements in negative symptoms as well. So, again, if you remember what I was talking about before, antipsychotics were only helpful mostly in positive symptoms of schizophrenia, the hallucinations, the delusions. They weren't as helpful in the negative symptoms, that flat affect or inability to have pleasure in life. So the glycine was helping with those symptoms as well. And then there are a couple of studies. See a comment here. Why is it easier to cause hallucinations with cannabis than it is with amphetamines? Um, it it's not that it's easier to cause hallucinations, but people can have a varied response. But cannabis, probably because of its effect on the NMDA receptor and um, it's the NMDA receptor, it's blocking it. And if you already have a hypofunction in that use, that glutamate and the NMDA receptor, which is the glutamate receptor, then you'll be at more risk for schizophrenia, which is a long-term psychosis. So any of those other drugs that I mentioned, you can have like psychotic symptoms with it, but cannabis was found to be most at risk for having both this psychosis and long-term psychosis, which is schizophrenia. Okay, so I want to show you this study. Okay, so this was just a study. I have so many studies I could show you, but this was one on a couple of pilot studies that looked to treat those at risk for schizophrenia with glycine. So these were people that were already experiencing psychosis, but it hadn't been long enough to diagnose as schizophrenia. So this is where we want to be able to help people right away, because you can have the most effect before their brains start to deteriorate. So one of these pilot studies was an open label trial, so they knew what they were taking, and the other was a double blinded study. In both studies, large improvements were seen in positive symptoms. Medium to large improvements were seen in negative symptoms, and medium to large improvements were seen in cognitive symptoms for the open label trial. These results are so promising. I mean, they found improvement in symptoms in every category of symptoms, the positive, the negative, and the cognitive. So overall, that's really amazing. And I have seen this improvement in people who had like early psychoses, and we started to use some glycine along with some other supplements and looking at dietary things. There's so many things to look at, but we didn't even use the high doses that were used in the study, because they were using doses like 70 to 80 grams. And one study it was 60 grams, but they didn't see as much effect in the 60 grams as they were in using like higher doses than that. But in my experience, that it's really difficult to reach those high doses. Overall, glycine appears to be well tolerated, but you start to get some GI upset even in much, much lower doses. And so I kept thinking about, like, I wonder how else we could use this. And I'm looking for psychiatrists that are treating in this way. So if you are a psychiatrist, or you know of any psychiatrists that are using glycine to help their patients with psychoses or schizophrenia or any of those spectrum schizophrenia like issues, then please let me know. I would love to get in touch with them. I have tried to get in touch with the researchers for some of these studies, but they didn't even know any psychiatrists that were currently using it. And I also know that because of the funding with the studies, it's a little bit tricky because the pharmaceuticals, the companies making the antipsychotic medications don't want to see a larger effect with something really cheap like an amino acid compared to the pharmaceuticals. And there was one study that did show that it was showing at least the effects are better as compared to a pharmaceutical. And so there's not going to be as much funding if to compare it to a pharmaceutical. Do you see what I'm talking about? And so it's it's hard to get all that research, and some of this research is decades old, and we're done at like reputable places, including Yale and other tertiary care centers that are have these well-renowned researchers, and yet this is not information that is widely known in with psychiatrists I've talked to, and in mainstream. So that's why I'm talking about it here because I want to get the conversation going. And I'm wondering what else we could do. Like, I'm wondering if a liposomal form of glycine might be able to increase the ability of the glycine to cross the blood brain barrier at lower doses so you don't get all that GI upset. I also came across another study or a few other studies looking at sarcosine, which is another amino acid that can boost glycine activity by blocking its reuptake, meaning it lets it hang around longer. And so you might be able to get away with either lower levels of glycine or maybe just taking the sarcosine alone. I don't have an experience yet with that, and I'm would love to have this dialogue with other specialists that have been looking into this. And um, there's many other supplements that can be helpful too. For example, folinic acid or methylfolate. So in some people, they have some variations in their methylation genetics, and they cannot get the folate into the brain to be used, and so they need a different form of folate. There is a folate receptor antibody test, FRAT test, which is starting to get more popular now, where in certain people they're making antibodies to the receptor, so blocking it. And so you need to use something like folinic acid or leucovorin for that to be able to enter the brain. That's helpful for autism as well. Omega-3s, glutathione or NAC, N-acetylcysteine, vitamin E, taurine, so many things that we can talk about. I'm mentioning those just briefly here because I want to give you some hope that there are other things that you can do and either early on before antipsychotics are warranted or even with antipsychotics. And please talk to your psychiatrist about this and have them look up the literature. If you need any links to articles, let me know. I'll see if later on I can drop some into the comments section so that you can look them up yourself. And so lastly, how do you talk to kids and teens about cannabis use? So I did read this. These were some great questions by Carrie Bearden, who's a professor of psychiatry and biobehavioral sciences and psychology at the UCLA. And she wrote this article on cannabis use and psychosis for Scientific America. And she suggested the following questions to ask: why do you use cannabis and how do you feel afterwards? Now, these questions aren't just for the kids and teens, these can be for adults too. Why do you use cannabis and how do you feel afterward? Why might you stop using it? And do you think you could stop if you needed to? And then why not try stopping for a few days and see how you feel? So these answers can help determine if a person has a cannabis addiction. For the last one, which says, why not try stopping for a few days and see how you feel? Now, if someone's been, just a caveat there, if someone's been using cannabis heavily or daily use for a long time, then it may not be able to be stopped immediately. It may need to be weaned down because Even if you're using something that's not great for your body overall, if you stop it suddenly, then you can get these withdrawal effects, and that can throw you alone can throw you into psychosis. So if it's a lot for long term, then wean down. Uh, Sometimes people can't stop or aren't willing to. And so for them, um, she said that they recommended that they avoid high potency products and choose instead products with higher CBD to THC ratios. Uh, and I feel like this is such an important topic to talk about, and to talk about with your friends, and how, so that they can talk to their kids and other family members or loved ones that use cannabis. And if you have anyone that is experiencing even mild psychosis, then this is valuable information that could save a lot in the long run. And if you are someone or know someone that is experiencing psychosis or has schizophrenia, there is still hope. And there are things that you can do to help alleviate the symptoms. For some people, it may not be, they still might need to be using antipsychotics. So please work with your physician, with your psychiatrist. I am not telling anyone to stop their medications. I'm giving information that can be used in addition to whatever you're doing, and with dialogue with your physicians, with your healthcare team, because for problems like this, it does require a team approach. And integrative holistic medicine needs to be a part of that approach, because right now, as it is, the bar is being held rather low. And there are things that are already in the medical literature that we have evidence for that can raise that bar of health and medicine and our potential for health even higher. And we need to maximize that. It's not something that we can ignore. So please share this with anyone that you think could benefit from it. As I get updates, then I'll come back and see how I can update everyone, because this is an emerging topic and more will be coming out with this in the future. There is a trial going on now with looking at sarcosine and how it might be able to affect glycine um, function in the brain. So there are clinical trials going on now, and hopefully we have more and more light on this subject as we go on. So lots of love to all of you. Thank you so much for listening. Please share this, like, subscribe. If you would like to connect with me in other ways, you can on Instagram at All Worlds Health, on Facebook at All Worlds Health and Pediatrics, on my website, allworldshealth.com. And I send an e-love letter out about once a week or every other week on Wednesdays, and you can sign up for it there. Lots of love to all of you. I believe in you, and I hope that you believe in you too. So I'll see you next time. Bye. Thanks for being here.